is Diagnosis Glaucoma with your hosts, Dr. Mona Colleen
and Dr. Harry Quigley.
Today we're going to have episode number 46, which is about vitamins and glaucoma. Specifically, the vitamin is nicotinamide and a chemical called pyruvate. And joining us today is potentially one of the U.S. experts in this area, Dr. Aakriti Garg, who was a fellow with us at the Wilmer Institute, a glorious year we had together, and she's now assistant professor of ophthalmology at Columbia University. Aki, where'd you come from, and what are you up to these days? Just very quickly in general, so the audience will know that you're multi-talented.
Oh, that's so nice. Well, thank you for that wonderful introduction. So I am now a glaucoma specialist at Columbia University. As Harry mentioned, I did glaucoma fellowship at Wilmer, and prior to that, I was a Columbia ophthalmology resident. I was really interested in ophthalmology because of the profound impact vision has on one's quality of life, and I was drawn to glaucoma because it's an important public health problem, and it's a condition that's relatively asymptomatic in its early stages, meaning that the physician has to be pretty skilled at communicating with patients because patients often require a close follow-up and treatment, although they may not have any problems. I felt like I was up for this challenge and would be really fulfilled by this connection that I would have in educating patients, and I found that to hold true during my practice.
So when we talk about educating patients, we often get asked questions by patients about, well, doctor, I'm taking all these eye drops, and I know you told me there's procedures and surgery, but what else could I be doing for my glaucoma? How about vitamins? Should I be taking vitamins? And the standard answer to that question for decades has been no, vitamins really wouldn't help any, just be, eat healthy. What we're going to be talking about today is that it may be true that one type of vitamin actually has a benefit for glaucoma. So why don't you, if you don't mind, tell our audience what was the origin of this idea that nicotinamide and pyruvate might be beneficial in glaucoma, and where did it come from?
Great. So our insights on nicotinamide and pyruvate use in glaucoma come from the laboratory, where basic scientists have been able to study molecular changes in glaucoma. A lot of what we know about the human eye in glaucoma comes from mouse models of this condition. And one of the findings in mice with glaucoma is that there are some changes that occur within the mitochondria. This is a special type of small cell organ or organelle that acts like an energy powerhouse for the cell. It breaks down the food we eat and creates fuel for the cell. These changes have been found to occur in retinal ganglion cells. This is a specialized type of cell that connects the retina, which is the light-sensing part of the eye, to the brain via the optic nerve. There's also, of course, neurodegeneration in glaucoma, in which the optic nerve starts to degrade or die off. But interestingly, the changes to the mitochondria have been found to occur before the neurodegeneration or changes to the optic nerve in some studies. And because the mitochondria doesn't work properly, the metabolism of the cell goes awry and the energy supply is depleted, and then those retinal ganglion cells that are so important start to die off.
So one way of thinking of it is that your lithium-ion battery is uncharged.
Exactly like that. The power is out.
So in the mouse, did giving vitamin B3, nicotinamide, did it help the mice?
Great question. So maybe I'll just quickly talk about what nicotinamide and pyruvate are. So nicotinamide is essential for many of these biochemical reactions in the body. It can be absorbed in the food and is a part of many over-the-counter multivitamins. Another name for nicotinamide is niacinamide. You may see that on the labels of various multivitamins. And pyruvate is a supplement that's normally created in the body through a cycle called glycolysis, in which glucose is broken down, the food we eat is broken down, and glycolysis has been found to be impaired in mouse models of glaucoma, and pyruvate levels start to decrease in these animals. So what sort of role do these supplements or vitamins play in glaucoma treatment? So nicotinamide has been shown to prevent glaucoma in mouse models of glaucoma, and in these animal studies, 93% of the eyes of animals who received high doses of nicotinamide in their drinking water did not develop glaucoma. And combination treatments, including both nicotinamide and pyruvate, have been actually most effective in preventing glaucoma and have been shown to enhance protection with even lower doses of nicotinamide. So you didn't need those high doses that were used in some of the other studies.
When we say it prevented glaucoma, we really mean, and this is how we do speak with our patients, but it didn't stop the animal from having a high pressure. whether the pressure was spontaneous or whether it was induced by blocking up the outflow, but it prevented the cell death of the nerve cell that you call the retinal ganglion cell. Sorry to interrupt. Go on.
That's a really important distinction because these therapies are probably pressure-independent therapies. So in glaucoma, we're very much focused usually on lowering the pressure in the eye because that's been found to be the evidence-based modifiable risk factor in this condition. But potentially these therapies are going through a different pathway that's really working on protecting the optic nerve independently of the pressure. And some investigators even looked at combinations of gene therapies that produce an excess of certain metabolic factors, plus supplementation with nicotinamide, and have found that the odds of developing optic nerve damage potentially becomes even lower with this combination gene therapy and supplementation treatment.
So one of the problems has been that my research and others in mice very often hasn't gotten translated into a real human therapy. But you guys did a study at Columbia during the middle of the pandemic, which kind of opened everybody's eyes. Can you tell us a bit about that trial?
Sure. So this was a pilot randomized clinical trial that was performed in 2020. And as you mentioned, this was during the pandemic, so always a tough time to perform research studies and even provide routine clinical care. But in this pilot trial, participants were randomized to receiving either a combination of 3 grams per day of nicotinamide and 3 grams per day of pyruvate or placebo for a period of 8 weeks. So this was a masked, randomized clinical trial, meaning that physicians and patients did not know which group they were in. So they didn't know if they were getting the active products or the sugar pills, essentially. And this was a randomized control trial, as you mentioned, which is considered the highest level of evidence in medicine. So although this was a relatively small study, it was one that probably provided us with important findings that were free of some of the bias that may exist in some retrospective studies, for example. So the endpoint in the study was looking at neurorecovery. So what does this mean? Essentially, the researchers hypothesized that a short course of these supplements would be associated with restoring the function of these damaged cells. So if we gave the group that got the study product, the active study products, the nicotinamide and pyruvate, would probably have some sort of improvement in their visual field as compared to the group that got the sugar pills. And in fact, that's what they found. They found that there were 8 more locations in the visual field with some improvement compared to baseline in the group that got the nicotinamide and pyruvate versus those who got the placebo.
So this is a visual field test that most patients who have glaucoma would have had a visual field test, and of course everybody hates them. And on the other hand, that's how we tell whether someone has normal function or not. So out of the 50 some odd points in the visual field test, 8 of them getting better, that was significant enough to be encouraging, correct?
It is encouraging for us as researchers. Is this visually significant for patients? Could they tell that they were doing so much better after these 8 weeks of supplements? That's probably unlikely. But we did see some signal, and that meant that maybe these study products were reaching the target tissue. And this is promising. And, whether this means that the patients are going to have meaningful neurorecovery, it just remains to be seen in larger, longer trials.
So that led you to the next big study, right?
Yes. So we are now looking for evidence of what we call neuroprotection over a 20-month period. And we wanted to see if these agents, nicotinamide and pyruvate, will help in preventing glaucoma worsening. And since glaucoma usually worsens slowly, this is a longer-term study. So instead of 2 months, we're now looking at 20 months. And in this study, our treatment design is, our treatment groups are pretty similar to what we had in the prior study. Half the participants are getting either a combination of nicotinamide and pyruvate, and the other half are getting placebo. All participants are ramping up their dose over a 3-week period, starting at 1 gram a day for a week, then 2 grams a day for a week, and so forth. And this is really to increase tolerability for folks.
So is it hard to tolerate the full dose? How many people have to drop out, would you estimate?
That's a good question. So over this 3-week period where we increase their dose in a graduated fashion, people do have GI side effects. People report, diarrhea, some nausea. Some of that may be related to taking multiple pills at a time. But if one has prolonged diarrhea or prolonged nausea, certainly that could be a reason that someone would be not as interested in participating. I have found, I guess in my experience and as well as what's been published, is that after people are done with this 3-week ramp up of the nicotinamide and pyruvate versus placebo, they actually tend to tolerate these pretty well.
Well, that's really true. That's true. It's true for so many things that we give patients. I mean, this is true for the anti-anxiety medicine, the SSRIs. The people ramp up over a considerable period of time, so the body gets used to it.
Yes, you make a good point. And I think, since these are supplements and maybe not something that's prescribed, maybe people are kind of really on the lookout for symptoms. We're also calling patients, very frequently asking them if anything's going on. So we hear about all sorts of issues that might be happening for the patient. Whether or not it's related to the drug, it's unknown. But the literature has shown that, GI side effects are associated with these compounds.
So there's the difference. The first study you did was about regeneration. In other words, a very modest, slight improvement in the function. This one is to detect whether or not over a longer period of time, people don't get as worse, and that's called neuroprotection.
That's exactly right.
Now, yours is not the only group doing such studies, and I know you listed for me, I got an education here, a whole bunch of studies that are being done worldwide. And what are the general protocols that are being carried out in these studies, and how do you evaluate them in terms of just how the studies are designed?
Sure. So there are quite a few studies going on, as you mentioned. One has results that are publicly available. This was a study done in Australia. This was a double-masked crossover randomized controlled trial, which is a whole lot of words, but essentially what it means is that there were 2 groups. One got nicotinamide, one got placebo. Interestingly, in all of the trials that are going on around the world, they're looking only at nicotinamide. They are not looking at pyruvate. We're the only ones who are looking at the combination. So, in this Australian study, one got nicotinamide, one got placebo. They were on it for a certain period of time, and then they actually crossed over and they switched places. So the people who were getting the nicotinamide then got placebo and vice versa. And they were looking at changes in the inner retinal function as well as the visual field. And they found that the retina may be functioning better in the group that received the nicotinamide. And there was a trend towards possible improvement of the visual field.
So this one's a regeneration study. This is a short-term, did people get a little bit better?
Exactly. It was over a short period of time. There are several ongoing clinical trials that have just started recruitment that are longer-term studies like our current ongoing study. In Sweden and Australia, they're doing the glaucoma nicotinamide trial. Interestingly, this trial has 2 cohorts. In the Swedish cohort, they're including patients who are newly diagnosed with open-angle glaucoma. These are people who have not yet started any sort of treatment for their glaucoma, and they are randomizing these individuals to receive either nicotinamide or placebo. These patients will not be getting pressure-lowering treatment that we usually associate with glaucoma. They're only going to be getting these vitamins or sugar pills and followed for a period of time. They're also looking at healthy subjects and giving them nicotinamide, and they're going to follow them over time. And it's not exactly clear how they intend to study these folks, but maybe they'll look to see whether these people end up not developing glaucoma. Their Australian cohort, similar to our study, these are glaucoma patients who are receiving pressure-lowering treatment and are also going to get either nicotinamide or placebo. And in this study, they're looking for visual field progression over a period of 2 years. There are studies in the UK that are also very similar to the Swedish and Australian studies. And then in Hong Kong, they're looking at a slightly different agent. This is nicotinamide riboside. And nicotinamide riboside may be metabolized differently than nicotinamide alone. So they're actually using a smaller dose. They're using 300 milligrams of nicotinamide riboside as opposed to the 3 grams of nicotinamide that is being used in all the other studies. And in this study, they're getting either this nicotinamide riboside or placebo. They're continued on their pressure-lowering treatment, and they're followed for 2 years.
So I think that with all of these studies going, one of the really good messages here is that we're going to know within 2 or 3 years, once these studies start to be presented, whether there's actual benefit. Now, you've already mentioned that this is a standard vitamin. And everybody hears about, there's a new therapy, a new gene therapy for sickle cell disease, and it only costs $200,000 a day. Is this going to be an expensive drug like those?
You make a great point. So this is an over-the-counter product. It's available at your local vitamin store or grocery store. And one would think it's something that you can just pick up off the shelf and start using for our study. But this nicotinamide and pyruvate are actually now registered with the Food and Drug Administration, or the FDA, as investigational new drugs for glaucoma. And that's because of a potential new indication that we're studying for these supplements. They will continue to be low cost, even if, they're found to be a potential disease modifier in glaucoma. And they're relatively low risk. We talked about the most common side effects are GI upset that lasts for a short period of time as one is ramping up therapy. However, there is a need for monitoring with these study products, especially nicotinamide, because it has been associated with liver damage. For this reason, participants in our study are being monitored very closely with liver function tests at baseline, a week or two after starting the study products, 2 months thereafter, and every 4 to 6 months for the remainder of the study, because there is a concern that this product could impact the health of the liver. So very important to think about that. But you're right, this is a relatively low-cost product as compared to everything else that's out there, especially some of the newer drops for glaucoma.
Well, I'm interested because the Food and Drug Administration wouldn't have any normal control over a non-prescription drug. Now, you need an investigational drug license to test it in a human research study. But why would the FDA need to have anything to do with nicotinamide once you show that it's beneficial? Aren't people just going to go buy it?
Yes.
Which I'm not against. I'm saying that may be exactly what happens, though.
I think that is what's going to happen. But for the purposes of research, they are providing us with some regulatory oversight.
So a patient comes into your office tomorrow. Well, it's Saturday tomorrow. But if a patient comes into your office at your next clinic day and says, "Doctor, should I be taking this?" What are you telling them right now?
Well, Harry, I'm sure that both of us are seeing patients who are doing this because of the information that's available out there about these ongoing trials. So I tell people to proceed with caution if you're planning to use these supplements outside of the research setting. At the very least, one needs baseline liver function tests and follow-up tests every few months. And I tell people that the doses that we're studying are 3 grams each of nicotinamide and placebo, but this is the research setting where patients are being very closely monitored. For home use, I would say certainly no higher than 3 grams per day, and I really do recommend close monitoring with the primary care doctor or other type of internist because there is the possibility of liver damage with these products.
Can somebody get Pyruvate over the counter, the other thing that you're testing?
It is difficult to find, but it is available over the counter. So, searching online, patients have been able to get their hands on it.
Well, okay, this has been very, very interesting, and I'm sure patients are going to want to listen to this podcast. Are there any other aspects of this that we haven't touched on yet?
I think we've covered most of it, but something that to think about is our trial and the trials going on around the world are looking at open-angle glaucoma patients. But open-angle, that component really may not be essential for the success of these study products. All glaucoma patients may benefit. As you pointed out, this is a therapy that's not reliant on pressure. It's not reliant on the angle. It may be a totally IOP-independent mechanism here. So potentially this therapy could be helpful for all types of glaucoma and potentially even other types of neurodegenerative diseases.
Well, now, for a plug for the study, anybody who goes on to clinicaltrials.gov will find your study. But if I understand it, Margot, Atakulova, Margot Atakulova, is a person you could contact to be part of your study. Are you still recruiting?
We are still recruiting till the end of 2024. And I guess if you'd like her email, it's ma3448@cumc.columbia.edu.
I'm going to repeat it so if people will get a pencil out. ma3448@cumc.columbia.edu. Well, for those who are interested or who listen to this podcast and wanted to now hear a bunch about other glaucoma issues, diagnosisglaucoma.com is the main website, and wherever you get podcasts, you can listen to the other 45. I want to thank Aki for providing us with this really fun and interesting information. Thank you.
Thank you, Harry. I'm honored to be on this podcast.
Thank you for joining us. Until next time, your mom says take your drops.